like you.
I would request all our guests to come for the left row. Ma'am, please. Sir, please. Left hand.
गणदैवताय गणाध्यक्षाय धीमहि गुणराज
Thank you, everyone. I am profusely elated to take an opportunity to request our distinguished chief guest, Professor Dr. Pushparaj Samal Singhar Sir, Medical Superintendent, IMS and Some Hospital, Bhubaneswar. With over 20 years of experience, Sir has more than 15 research publications, including 5 in Scopus journals, and has actively contributed in national and international conferences. I request Sir to kindly occupy the chair on the dais. Sir, please.
Let us take the opportunity to welcome our admirable guest of honor, Professor Dr. Rajesh Kumar Lenka Sir, Medical Superintendent, IMS and Some Hospital 2, Fulnagra. I request Sir to kindly occupy the chair on the dais. Next, I would like to introduce our chief speaker, Professor Dr. Sashmita Das Ma'am, Dean Some Nursing College, Bhubaneswar. She has over 20 years of experience in nursing education and leadership, authored books, published 80 plus research papers, holds healthcare patents, and continues to inspire as a mentor and academic leader. Ma'am, please give us the honor by having chair on the dais.
I would like to welcome Madam Mrs. Minati Mishra, Nursing Superintendent, IMS and Some Hospital and Chief Advisor, IMS Bhubaneswar Chapter. After completion of her nursing training from IGS Raulkela, Madam started her initial career days from B.M. Birla Research Center, Kolkata in the year 1990. Madam is having a total of 31 years of experience in nursing while working in various corporate hospitals across the country. Thank you.
Next, I would like to welcome Mrs. Shobhamanjari Samal Ma'am, Additional Nursing Superintendent and Patient Safety Officer at IMS and Some Hospital, Bhubaneswar, with over 27 years of experience and as chairperson of the Indian Nursing Society. With her visionary leadership and passion for nursing, she continues to inspire colleagues and students, shaping the future of healthcare with dedication and grace. I request Ma'am to kindly occupy the chair on the dais. Now I would like to request our dear volunteers to felicitate our honorable guest. Now the time has arrived to add some dignity and fragrance to our dice. It is the time to invite our Honorable Additional Nursing Superintendent Ma'am, Shobhamanjari Samal, to deliver the welcome speech.
and a very good afternoon to one and all. Respected dignitaries on the dais, respected Medical Superintendent Professor Dr. Pushpara Samanth, Chief Guest of today, IMS and Sound Hospital. Welcome you, sir. Professor Dr. Rajesh Kumar Lenka, sir, IMS and Sound Hospital, Pulanapara. I welcome you, sir, for the today's Skillathon. I welcome to Dr. Sasmita Das, ma'am, Dean SMC. Welcome you, ma'am. I welcome the nursing superintendent of IMS and Sound Hospital, Mrs. Minati Mishra. Welcome you, ma'am. I also welcome to all the dignitaries of the dais, of the nursing superintendents of different hospitals. Madam Sumita from Sunshine, Pushpalata Madam from Sports Hospital, Mr. Bhima from AIMS Hospital, and Sarika Madam from AIMS Hospital, and new DNS from IMS and South Hospital, OSD sir, Dr. Ratha, all my dear students from different nursing colleges. Yesterday we are having 2 days Skillathon, IMS Skillathon, 29th and 30th. Yesterday it was for the nursing officers, and the topic was about CBC line care management, a holistic approach. And today's 30th of August, it is for the students of different nursing colleges. There are 10 to 12 nursing colleges who have joined here for this training session. I am really thankful to the INS who has given this opportunity and given permission to giving training to the students. If I am not wrong, it is really first time in Odisha we are doing the INS Skillathon with the support of the IMS and SOM hospital management and mostly very honorable, respected our founder president sir, Professor Dr. Manoj Ranjan Naik sir. It is really, we are very much thankful to the management. Anytime we tell about the training, the skill development, they have supported. What I'll tell about my medical superintendent sir, Professor Dr. Pushpara Samanth sir is very supportive, and when I told sir we are doing for a training to the students, he was very much happy and he has given permission immediately to happen it in IMS and SOM hospital. As it is a national program, as I said, it is Infusion Nurses Society and the collaboration with IMS and SOM hospital and with other knowledge partners of INS. So we have done it in this hospital because if you say talk about the Shiksha Anusandhan University, here everybody gets the training. There is an opportunity taking training, availability of all the equipments, availability of the manpower, availability of the good trainers, where the students can get trained nicely and can implement in their day-to-day patient care. So, sir, yesterday there was around 18 hospitals who have joined for the Skillathon. And this is first time in Odisha. I am very much thankful to everyone who are participating, who are supporting, and who all are being the participants. Last but not the least, my nursing team, my nursing superintendent, my all DNS, my ANS, educators, ICNs, my staffs, and if you see in the backstage, all are present, how the program will be done nicely and appropriately in time. When there is a time management, they have never shown to anyone, but they are managing by themselves. That is their good quality, and that is headed by our nursing superintendent, Mrs. Minati Mishra. Thank you all. Thank you for joining. And the most important part, which will be in the second half, it is about, as I have already taken a session today regarding the PIVC, peripheral intravenous catheter. This is the basic procedure for the nurses and the nursing student. Being the future of the nursing profession, you have to learn more and implement more. When you go to the hospitals, nobody should tell that these students do not know how to put a cannula. As you know, it is 70 to 80% of the hospitalized patients are getting the IV cannula, and putting a IV cannula in one time is a challenge for the all nursing staffs. And if you learn from here, you will be a good, skillful nurse in future days. That is my motto, that is everyone's motto, that is INS motto, and that is IMS and some hospitals who are university motto. Thank you so much. Thank you for joining.
Thank you so much, ma'am, for your kind and inspiring words. I now request our distinguished chief guest, Professor Dr. Puspara Samansinga, sir, to kindly share a few words of wisdom with us. Sir, please.
Very good afternoon. My namaskar to all of you. Esteemed dignitaries on the dais, Professor Rajesh Kumar Lenka, Medical Superintendent, IMS Sam Hospital 2, Dean, Sam Nursing College, Madam Sasmita Das, Nursing Superintendent Minati Mishra, Additional NS Sobha Madam, and all esteemed faculty members from different colleges and OHD sir and all dear students. Are you all happy or not? But you are sitting so gloomy and you're not smiling? तमने खुशी तो ये प्रोग्राम अटेंड करिए को हैं so learning to learn and relearn and unlearn it's a continuous process आपण माने जितने की जानी ना that learning is so important. Now you don't know anything, you ask your teachers, they will tell you why learning is so important. It is like a mechanical method. You are doing first semester, second semester, third semester. It is very mechanical. But more, you ask your teachers, they will say that is very important. You ask your principal, she will say that is very, very important. So learning the body with your experience, the more patients you see, the more you work, the more you spend time with nursing, with the patients as a nurse, nursing officer, the more you will know the requirement, the more you will feel that I need more skills, I need more knowledge, I need more patience. That happens with everybody. It's happening with me. Every day I learn. I am learning here since last 2 days in this program also. Kali jo astile jo guest mane they spoke so well and they just focused on couple of things like maintaining a smile, maintaining silence. That will help us to take the right decisions. In chaos, if our mind is in chaos, will we be able to take good decisions? नहीं परिबे. आमे मुंडटा को जितने काम रखिबा सेते ठीक डिसीजन नहीं परिबा. जितने chaotic करिबा आमे डिसीजन डा नेला लोटे कष्ट हबो. Maybe we may not take the right decision. So smile and silence is very important in our daily work, both at home and at workplace. These are life skills. These are life skills. So this आपण माने तो निहाती सिखिबे जो IV cannulation, the experts will teach you. It is very important. But slowly we are moving in a direction where most of the things of the patients will be taken care of, and it is being taken care as of today also. It also happened 20 years back, 50 years back. Most because the nursing officers stay with the patients 24/7. How ki rohuchandi? Patient ko pakhare kiye? Patient ko pakhare nurse. So I don't see it as a duty, as a more than a professional. I see it as a service. It is a seva. It is a bhakti. You can say it's a bhakti. Thakur ko jodi puja kara jauchi, patient manu ko semti ame tike patient gote kashta re achandi, gote lokoti je maximum kashta se to hospital asibo na. ये भल अच्छी से कहीं हॉस्पिटल से क्रिकेट मैच की फुटबॉल मैच देखियो स्टेडियम रे से मॉल बुलिया जीव मार्केट बुलियो फ्लड केते पानी आसला पानी रिवर जाई देखियो नहीं जे अत्यंत कष्ट फिजिकल मेंटल लागोनी फिजिकल सफरिंग एंड फाइनेंशियल लॉस ड्यू टू ट्रीटमेंट एक्सपेंसेस से हॉस्पिटल आसु ताकू जदि आमे टिके दीपद भल कथबार्ता करिबा भल रे टिके ट्रीट करिबा दैट इज वेरी इंपोर्टेंट. And that helps in the healing of the patient. That helps the patient to get recover from the disease process very soon, because the nursing are staying with the patients 24/7. and for intervention, କୋଉ ଟାଇମରେ ଇଣ୍ଟରଭେନସନ ଦରକାର, କୋଉ ଟାଇମରେ ଅର୍ଜେଣ୍ଟ ଗୋଟେ କଲ୍ ଦରକାର ଡାକ୍ତରଙ୍କୁ, that will come from the knowledge and the skill. जो अल्प समय कथबार्ता करेंगे, जो गोटे स्टेटमेंट करेंगे, the trigger, that will be the trigger for the doctor to intervene, that will come from the knowledge and the skill. आपनकर experience, knowledge, skill एगुरा सब काम दबो सेते बेले. So it is very important that we keep on learning. We are all learning. हमारा NMC रे National Medical Council रे गोटे अच्छी, we are all Indian medical graduates are lifelong learners. ଏବେ ଆପଣଙ୍କୁ ଲର୍ଣ୍ଣିଂଟା ଯେତିକି ଇମ୍ପୋର୍ଟାଣ୍ଟ ଲାଗୁନି, once you start working as a nursing officer, as a professional, ସେତେ ଆପଣ ଜାଣିପାରିବେ the importance of learning and why learning is so important. ଆପଣ ମାନେ ଖାଲି ତ କାମ जो 8-9 घंटा कि 7 घंटा काम कले पेशेंट को पाखरे, that has its own toll, it takes its own toll. So you have to be fit to come every day with a sharp mind and an eagerness to work with the patient every day daily. For that you have to keep in mind couple of things. How you will be very positive in your daily approach. How you have to be healthy. How you will maintain a calm mind. ସେଥିଲାଗି ଯାହା ବି କାଲି ଥିଲା ନା ଆମ ନ୍ୟାସନାଲ ସ୍ପୋର୍ଟସ ଡେ. Yesterday was a national sports day. It was the birthday of କିଏ ଜନ୍ମ ହେଇଥିଲେ ଆମର ସବୁଠୁ ବଡ଼ ସୁପରଷ୍ଟାର ସ୍ପୋର୍ଟସମ୍ୟାନ ଇନ୍ ଇଣ୍ଡିଆ ଧ୍ୟାନଚାନ୍ଦଙ୍କର ଜନ୍ମଦିନ ଥିଲା. ଧ୍ୟାନଚାନ୍ଦ କୋଉ ସ୍ପୋର୍ଟସ ଖେଳୁଥିଲେ? He was a magician of hockey. ତାଙ୍କର ଯୋଉ ଷ୍ଟିକଟାକୁ ବହୁତ ଥର ଡିଫରେଣ୍ଟ ଗେମ୍ସରେ, ଇଣ୍ଟରନ୍ୟାସନାଲ ଗେମ୍ସରେ ତାଙ୍କ ରେଫରି ମାନେ ନେଇକି ଦେଖନ୍ତି, ପୁଛନ୍ତି ଆରେ ଅଠା ବଟା ଲାଗିଯାଇଛି କି, କାରଣ ବଲଟା ଯାଉନି ହକି ଷ୍ଟିକରୁ ବାହାରୁନି. ମେନି ଟାଇମ୍ସ ଯେମିତି ତେନ୍ଦୁଲକରଙ୍କ ବ୍ୟାଟ୍ର ୱିଡ୍ଥ ମପା ହୁଏ, ସେମିତି ଧ୍ୟାନଚାନ୍ଦଙ୍କ ହକି ବହୁତ ଥର ପୋଛା ହେଇଛି ଟୁ ଚେକ୍ ଦ୍ୟାଟ୍ whether any glue is there. So that was the level of his magic in hockey. So ସେଥିଲାଗି ଆପଣଙ୍କର ଫିଟନେସ୍ ବି ବହୁତ important. We have to maintain our fitness. You have to keep on meditating to keep a calm mind. You have to, if I ask, କେତେ ଜଣ ଲାଷ୍ଟ କେବେ ତାରା ଗଣିଥିଲେ ଆକାଶରେ ଦେଖିକି ତାରା ଗଣିଛନ୍ତି? When it was last time you counted the stars in the sky or counted the birds in the sky, flying in the sky in the morning or evening? That is very important. That is to declutter the mind, to make the mind focus on something that is not your work, to relax the mind. କେତେବେଳେ ଯାଇକି ଯୋଉ ଶୀତ ଦିନ ଆସିଲାଣି ପତ୍ରରେ ଡ୍ୟୁ ଲାଗିଥିବ, ଡ୍ୟୁ ଯାଇକି ଫିଲ୍ କରିଛନ୍ତି? ଫିଲ୍ କରିବେ. It's very interesting. Or feel a flower or a leaf. So these are some of the things to maintain that your mind is good and healthy and positive, and a fitness regimen, exercise to keep your body fit. That is very essential so that every day you can come and perform at the best. So this is little bit of suggestion from my end to all the young students, all our nursing students. So happy to see them, and you always must keep smiling. That is very important. बहुत बहुत धन्यवाद. नमस्कार. जय जगन्नाथ.
Thank you, sir, for your motivating words. May I invite our chief speaker, Professor Dr. Sashmita Das ma'am, to bless us with their thoughts.
Very good afternoon to one and all present over here. Dignitaries on the dais, Professor Pusparaj Samant Singhar, Medical Superintendent, IMS and some hospital, Professor Rajesh Kumar Lenka, Medical Superintendent, IMS and some hospital 2, Miss Minati Misra, Nursing Superintendent, IMS and some hospital, Shobha Manjari Samal, Additional Nursing Superintendent, IMS and some hospital, dignitaries of the dais, all the organizing committee member, infusion nursing societies members, all the panelists, chairperson, moderators, all the delegates present over here from different colleges, schools, and different hospitals, invited guests, ladies and gentlemen. I am indeed privileged for being a part of this program and feel very fortunate to address you all in this August gatherings of this Skillathon 2025. It's all our credit that we have gone through a lot of advancement in nursing profession. Our nursing practice has seen many appendages up to the independent nursing practice. No profession has its strong footing without deriving the practice from the rigorous research endeavor. Therefore, in nursing profession, we need a scientific base to develop or to validate the nursing as a profession. There is always a room for improvement, but in healthcare professions, we need more achievement. We are not satisfied what we are achieving. And this INS Skillathon 2025 aims is to showcase the skill and expertise in the peripheral intravenous catheter insertions and management or maintenance, we can tell. Research, so many research you will get, and the research evidences suggest that 50% of complications arises after insertions of the peripheral intravenous catheter. And out of that 50% complications, 12% leading to longer the hospitalized stay. And from these complications, you will see that phlebitis will be 19%, and your occlusions will be 88%, infiltrations will be 14%, like that pain will be in 6% of cases. By understanding these statistics, we'll have to plan out the effective management to reduce the hospital stay of the patient, to reduce the risk of the patients, to enhance the patient outcome. And how we'll do that? So many sessions this workshop has kept for you, and nicely the panelists, different panelists, they have explained you regarding the different managements and complications, what complications will arise due to that. And you'll have to prioritize the communication technique. It is very important. We'll have to document very clearly. We'll have to establish the interdisciplinary collaborations. Patient documentation, clear patient documentation is very important for this. And in safeguarding, we'll have to see that how we'll insert the peripheral intravenous catheter, and how we'll maintain the standard protocols, how we'll follow that standard protocols, how we'll establish patient-centered care. We'll have to go through the holistic approaches. I expect that these 2 days events, Skillathon events, will be excellent opportunity for you all. You can show your competency in these peripheral intravenous catheterizations. And you will see that recently in nursing care professions that demands more evidence-based practice in every sphere of education and practice. So research aspect you should not forget. You will have to involve yourself in more research activities so that we can establish a good environment. This will be a very good exposure for you all. It will add significantly, it will add and it will contribute for the well-being of future generation professions. In these sessions, you will learn from each other. So it will be very good exposure for you all. I expect that this humble effort will go a long way in making this event a real instrument for developing our nursing practice. Thank you all. Wish you all the best. Thank you. Once again, thank you.
Thank you so much, ma'am, for your kind and inspiring words. And special thank you, ma'am, for joining us today despite of your busy schedule. We would be delighted to hear from our guest of honor, Professor Dr. Rajesh Linkasa. May I invite sir to speak a few words? Sir, please.
Respected dignitaries on the dais, Professor Dr. Puspara Samosinga, the medical superintendent, the Dean of SNC, Sasmita Das Madam, our Nursing Superintendent, Minati Madam, Additional Nursing Superintendent, Shobha Manjari Madam, all the resource persons present in the front chair, I think, and our OSD sir, Dr. Lingaraj, the media persons, and particularly our coordinators, those who are working behind the screen for this Skillathon, media persons, and our delegates, our students. I think you are a final year student, most probably all. All are final year students or interns? Interns, very good. So, namaskar and good afternoon to all of you. I am fortunate that I have been called for this occasion because I am proud to say, as our additional nursing superintendent told, that this is the first time we are organizing this type of hands-on training with our nursing students as well as nursing staffs. Now, as you all are in the profession of nursing profession, I will say, are you happy or not? Happy? Very good. Because if you are in a profession, you should first love your profession. You should appreciate, you should be glad that I am in a nursing profession. Because this is a hospital. We all are in the hospital we all are healthcare providers. Healthcare providers, that may be a doctor, that includes nursing staffs, other paramedical staffs. So we all work together for the betterment of the patient, isn't it? Yes. So now, why I am saying that we are healthcare professionals and we are doing our duty or we work together for the betterment of our patients, because ultimately, if patient satisfies, if patient attendant tells that, yes, we are satisfied, this hospital, the persons, the professionals, the healthcare professionals, those who are present, those who are working, they are treating us perfectly. If we think, maximum credit goes to nursing professions, nursing staffs. Because as our medical superintendent told, the nursing professions or nursing staffs always stay with the patient maximum time if you calculate. Isn't it? So your value, your presence, your technology, your technique, your skill, that matters a lot. For that reason, I think this Skillathon of IMS, they have organized one important topic, that is PIVC insertion maintenance. Because if you think, if you see that maximum patient, those who are admitted, maybe in general ward, maybe in critical care, anywhere else, maybe for OT, for operation, in the OPD for the blood sample collection, this procedure is very much needed. And this procedure, more than 80% patients we used to do this procedure. So this procedure also has some complications. So we need to know that. That's why learning is most important thing. You will learn more and more, then you will know what are the complications, what are the things we should follow, what your research persons, panelists they have told. I think they have already discussed with you all those things. So first of all, through learning, you should know the techniques and everything, every aspect of this procedure, so that you can go and you can practice. So once you will practice more and more, you will develop more skill. You will be a skilled person. In your childhood, just remember, ଯେତେବେଳେ ଆପଣ ଛୋଟ ପିଲା ଥିଲେ ଯେତେବେଳେ ସବୁ କେତେବେଳେ କେତେବେଳେ ଦରକାର ପଡେ କେତେବେଳେ ଇଞ୍ଜେକ୍ସନ ହଉ କି କେତେବେଳେ ବ୍ଲଡ କଲେକ୍ସନ ହେବାକୁ ଯାଉଛନ୍ତି ସମସ୍ତଙ୍କ ମନରେ ସେ ଛୁଞ୍ଚିଟାକୁ ଦେଖିଲାକୁ ଡର ଲାଗେ ନା ନାହିଁ ସମସ୍ତଙ୍କ ମନରେ ମତେ ତ ଲାଗୁଥିଲା ସୋ ଏଇଟା ଗୋଟେ ସମସ୍ତଙ୍କ ମୁଣ୍ଡରେ ସୋ ହାଉ ଟୁ minimize that stress that anxiety that is also important for that we need some gesture like what you have to smile you have to be polite you have to be compassionate you have to be patient you have to listen what the patient is saying mainly particularly pediatric patients how to deal with them ଯେତେ ଭଲରେ ଆମେ ସେତିକି ଚିନ୍ତା କରିବା ସେତେ ଭଲରେ ଆମେ insertion ଆମେ cannulation କରିପାରିବା because for cannulation you need proper site angle the procedures everything has been taught to you for that in clinical practice you need to follow those things by your attitude by your knowledge so I am not going to discuss anything about the complications what are the management what are the procedure you know all those things and it will be learned over here and this is a hands-on training you will also practically you will also be they will also teach the practical aspect of everything in second half okay so always try wherever anywhere any new things or any academic aspects or any CME or any hands-on training is going on try to participate always you learn more so that you can apply in your daily practice so once again thank you always try and we also wish for your grand success of the Skillathon and you will be happy that after this session the INS India CEO Colonel Binu Sharma he is going to interact online so once again best of luck thank you very much.
Thank you, sir, for your valuable words. It is my great pleasure to introduce Colonel Binu Sarma ma'am, our honorable national leader and president of INS India CEO of INS India. With over 4 decades of service, she has contributed immensely to both the armed forces and civilian healthcare, from her beginnings as a critical care nurse to leadership roles in renowned institutions like Max Healthcare and Columbia Asia. She has played a pivotal role in shaping nursing practices, setting up hospitals, and ensuring the highest standards of patient care. We are privileged to have her join us virtually to share an overview of INS. Ma'am, kindly address the gathering.
Namaskar and a very great good afternoon to all of you. What a magnificent gathering in the hall. I wish I was present there in person. My heartiest congratulations and appreciation to IMS and some hospital for organizing this very first Skillathon, a knowledge building and skill building session at the city of Bhubaneswar. I in person have never visited Bhubaneswar, but with such fantastic people there who are so pro nursing, I was just listening to all the addresses in last few minutes. I think that's such a fantastic place for nurses and nursing students to be in. My heartfelt, respectful congratulations and regards for Professor Dr. Manoranjan Nayak, for Professor Dr. Pushparaj, for Dr. Rajesh Lenka, for Shobha as well as Manati and the entire nursing fraternity at SUM and IMS for being part of this fantastic event. I represent Infusion Nursing Society India, and we all know that INS in India is part of INS United States. We are affiliated to INS United States. We formed this chapter in 2010 in India after having visited INS US in 2009, getting impressed by the work the society was doing in US and many other countries. We wanted to establish the infusion standards in the country. That is how it was established way back 15 years ago with like-minded nursing leaders with the also help of 3M and BD as our platinum partners. Infusion Nursing Society is a not-for-profit organization. The sole vision and mission of that is to enhance infusion safety, patient safety by improving knowledge and hands-on skill of the clinicians in the field of infusion. In today's time, almost every patient admitted in the hospital gets a peripheral IV line right in the emergency room or right the time he gets admitted on a patient bed. If that is the case, and these IV lines have to be inserted, maintained, managed without complications, with higher indwelling time by none other than the nurses. Hence, it becomes imperative that every single nurse in the hospital should be trained, should have a competency assessment, should be credentialed and privileged to be a IV cannulation nurse. Because although it looks to be a very simple procedure, peripheral IV cannulation, but it is so hard to master this skill. You need lots of compassion. That is the core competency of us nurses. You need the right attitude, the aptitude. You need the knowledge. Where are the veins, which veins to choose, which cannula to choose, what size to choose, which side of the cannula it has to go, what kind of a cannula you require, and how it has to be maintained, how flushing has to be done, how you have to maintain the sterile technique, how you have to keep it without occlusion, how you have to secure it so that there is no mechanical phlebitis and you have to take it out, how you have to do the right dilution of drugs so that there is no chemical phlebitis. So much of of science goes into, not just science, so much of art and science goes into a simple procedure like a peripheral IV cannulation. So the students who are here today, I understand there are about 126 students from various nursing colleges. You are all fortunate to be able to learn with hands-on practice on the mannequins. You are able to learn the skill which you will be required to use when you become practicing nurses. We had again a great conference yesterday, a skillathon rather, yesterday, with almost more than 155 nursing officers participating from various hospitals. I was just reading through the participating hospitals. So from various hospitals, they were part of it. If that is the response in Northeast, I think INS has more responsibility to reach out and do more skillathons and knowledge-based sessions. INS is already very, very active in the country. We've got about 5,000 lifetime members. We've got 18 state chapters. We've got nursing leaders from across the country who are part of this. We've got an electronic newsletter. We do a lot of skillathons across the country in hospitals and in nursing colleges. We do a lot of mastermind quiz, which are signature program of INS. INS also has a quality improvement certification, knows and infuse. Hospitals can apply for infuse and can be certified for 3 years by a team of expert assessors from Infusion Nursing Society. INS does an annual conference every year. This year it is happening in the city of Pune on 7th and 8th. We also have taken up a leadership development program under INS, healthcare related communication building under INS. So there is a big menu of things what INS is engaged in doing. I urge and suggest and request the nursing officers, the students who are our would-be nurses, to educate themselves about infusion practices. We've got a INS standard of practice book. Every 4 years, the book is updated. It comes to us from the US. We've got an editorial board which looks at the SOPs, policies, and protocols. You can, all the colleges here, the faculty here, the hospitals participating should get that book so that when you are forming your procedures, processes, and protocols related to infusion practice, whether it is peripheral IV cannulation, central line, arterial line, blood transfusion, dialysis catheters, midline catheters, you can refer to the book. It has got SOPs, practices, and guidelines for every single aspect of infusion for all population of people, special population, OBG patients, vulnerable patients, geriatric, pediatric, neonatal group, apart from the adult group. So this is so much of work which INS is doing, and so much you can engage with INS and you can gain from INS. So I am very pleased, honored, and privileged to be speaking to all of you on behalf of Infusion Nursing Society. I thank you all once again for a fantastic, magnificent 2-day skillathon. I wish to see more and more of these skillathons in the city of Bhubaneswar and beyond Bhubaneswar in Northeast. And I am so very pleased as CEO of INS, so very pleased that such large group of healthcare professionals are engaged in doing this skillathon, learning best practices. And I once again thank the senior authorities and management at IMS and some hospital for hosting this at such a big level. Thank you once again, and namaskar everybody.
Thank you so much, ma'am, for your valuable words. Your words have truly inspired our audiences today, and we are grateful and honored that you joined us today and gave this program a true meaning. And I would also like to extend my heartfelt thanks to ma'am that with your support, we have been able to make this 2-day Skillathon, first time in Bhubaneswar, a great success. Thank you so much, ma'am.
Thank you. Thank you, everybody. Yeah.
I would request all our dignitaries to come over. Now I humbly call upon our nursing superintendent, Madam Mrs. Minati Mishra, to share her inspiring words with us. Ma'am, please.
Very good afternoon, one and all, those who are present over here, respected medical superintendent, chief guest of this occasion, Professor Dr. Pushparaj Samanta Singha sir, chief speaker, Dr. Sasmita Das madam, Dean of SNC, guest of honor, Professor Dr. Rajesh Lenka sir, medical superintendent of Fulnakhara, all faculties from different hospitals, AIMS, Sunshine Hospital, and other hospitals, additional nursing superintendent, chairperson of the city chapter INS, Sunshine Hospital, Dr. Rathwa, and my lovely students from different hospitals. So it is very late, and if people have maybe hungry, so we should not waste time. I will not waste time much. One thing I can highlight that in our nursing course, in first year, we are studying that nursing profession is a science as well as arts. Without arts, you can't implement your science perfectly. If your art is insufficient, your science or theory or knowledge cannot be implemented perfectly. What is the art? In this, specifically in this occasion, in this Skillathon, in this session, what is your art? How that Binu Sharma madam already told, how you have to hold the cannula, how you have to position the patient, how you have to approach the patient, how you have to select the cannula. All these are arts. If you will not implement or learn the art, you cannot handle the patient. Am I right? How that bevel of the cannula should be. Okay. So all these arts we should know. And how that arts will come from this practice, from this experience and from this workshop. So most of the patient that when they are coming to our emergency or ward, 90% patient, for 90% patient we are doing cannulation because they are sick and immediately we have to intervene. We have to introduce the medicine, fluid, everything. So for 95% patient we are doing cannulation. And it is a indispensable tool to implement the medicines. And if you will not maintain meticulously this procedure, the patient will land in very much problems. That is, everybody knows that extravasation, thrombophlebitis, everything. And from that, patient will get bad impression or bad experience. If you do a good cannulation, patient trust will raise from that point only. Patient will think that I am in a safe hand. This hospital is good. This nurses are very skilled. Understood? So that we are the educated nurses, we are doing the evidence-based practice on our own. We are not doing anything. We are following some protocols, some ethics. So we are doing evidence-based practice. Okay, so this is a very good platform. You can learn and you will enjoy and have to implement. So lastly, I am extending my thanks that company Polymed, and most that thank to the additional nursing superintendent Shobha Manjari Samal, the chairperson of this chapter. She has arranged everything nicely, and my seniors, the DNS and all ANS in charges, also they are cooperating a lot. I can't explain you anything. So thank you all. Hope that you will enjoy this session. Thank you.
Thank you so much, ma'am, for your valuable words. Thank you all.